welcome back to my channel. It's a new vlog. I hope you guys enjoyed the last vlog and the last few vlogs I've been posting, keeping you guys updated. So here is what I know right now. I just went and did PFTs, got back about 20 minutes ago. They were still down. They're at 63. Not good. Not where we want them to be. The plan is to do a bronch tomorrow or Monday. It depends when he can get a spot in an OR to be able to do it, or wherever they do bronchs at. And of course, anesthesiologist to put me to sleep, all of that. They have to get that all organized, so never know if it'll be tomorrow or Monday. So I'm sure they'll let me know whenever they find out. Yeah, so that's the plan right now. I'm ready to just get this over with and hopefully feel better and get out of here and go home and not have to come in here for a while again. Like, you know, just stay out of the hospital for a while. I really, really hope that I can do that and have a good summer and not have to come in. That would be awesome. But I'm hoping that this bronch really, really helps and doesn't cause any damage or anything, because I know bronchs are also risky because they can also spread more bacteria in your lungs, which you definitely don't want. But they can also be very beneficial if they want to clean out your lungs and see why you're not improving. Like, they can see from the inside, you know. I feel like that would really help them a lot. So, and he's my new, you know, adult doctor. I've known him since I was little, but still, I feel like he should get a feel of what my lungs look like now. That way, he maybe has some more tricks up his sleeve to, for my lungs. So yeah, that's kind of where we're at. That's all I know right now, and I'll of course update you guys whenever I know when the bronch is and everything, and you guys will get to just see everything that goes on and all that. So I will talk to you guys later. Hey guys, so right now I'm walking down. Oh my gosh, look at this view, guys. Do you see this? How beautiful is that? But I'm going down to meet my dad right now, and I think I'm gonna go to the cafeteria and get me some food. And get me some food, and meeting my dad. He's coming. He came to see me, which I'm happy about. I haven't got to see him in a while. It's been a long time, and you know, it sucked being away from him, and I'm glad I get to see him. Hey guys, so welcome back to the vlog. I don't know why I say that every time I restart, so whatever. Anyways, so the bronch is scheduled. The bronch is scheduled for tomorrow at 1:30. So I mean, I'm glad. I'm so thankful that it's tomorrow. That way I don't have to wait till Monday. But it sucks that I have to wait until 1:30, just because usually if they say 1:30, they mean even later than that. And I hate having to wait to eat and, you know, just being nervous. But I'll have my anxiety medicine. I think they'll be able to give me that and stuff. So hopefully that will help with my anxiety and stuff. So I'm hoping that the procedure goes great and that they get this junk out of my lungs and that it really helps me. And I think it will. I really am hopeful, and I really think that it will help. So we are just, you know, ready to get this over with so that next week, hopefully I can get out of here. Like I said, I've been wearing oxygen a lot more than usual. Usually when I'm in the hospital, I'll just wear it like the first 2 nights, and then I don't need it anymore. But I've been so out of breath here lately. I've been having to wear it, and at night it kind of bothers me, and I'll end up taking it off. But my oxygen levels have not been normal. They've been like 91, and they're usually 99, or 100. So that's just not good for me, and it's not normal. So it's my favorite. Oh, it smells so good. Alright guys, I'll talk to you guys in a little bit. I'm just going to chill on my phone and stuff, and I will talk to you guys in a little bit. So, bye. Hey guys, so I'm waiting to go down to my bronch. It's 10:58 right now, and the bronch is not until 1:30, and I'm starving. Insane. But I think my mom's going to go out and get me some food or something after the bronch. So I'm pretty excited about that. This is all I can look forward to, is just to eat. I'm so hungry. But, yeah, so I wish 1:30 would hurry up and get here. I'm going to try and nap, I guess, until this surgery can get done, so that way I can get to eating because I am hungry. But yeah, I'm just gonna probably nap as much as I can. If I can even go back to sleep, those IV steroids are making me have really bad trouble sleeping. Woke up at 6 this morning and couldn't go back to sleep. So yeah, that's not normal for me. I never wake up at 6 voluntarily, but and the pump would not stop beeping last night, and yeah, the steroids pump didn't go. No, wasn't a good experience. But anyways, so I'm hoping we can get this bronch over with, and that even it might be able to happen even before 1:30, and that they can put me out and just get this done, because I'm ready to get it done. I'm so hungry. That's all I can say is I'm hungry. And I guess continue to watch some YouTube, stuff like that. And I've took my anxiety medicine, so hopefully that helps a little bit with my anxiousness, because of course I'm anxious. Everyone gets anxious and scared before they get put out to sleep. I think that's just a normal reaction. Everything's gonna be fine. So yeah, I will let you guys know when I'm going down there. I don't know how often I'll be able to talk to you guys, because they put you to sleep and everything, so obviously I can't talk while I'm asleep, but I'll let you guys know how it goes, before I go and everything. So I will talk to you guys in just a little bit. Hey guys, I had my bronch done earlier. I've had a really long day. My cough is even worse after the bronch, and I have pictures here and everything. My doctor said that my lungs looked way worse than he expected them to look, because all of my tests for like my infection, my inflammatory marker and all that has came back, better. Some pictures to show me so I can show you guys, and like there's some summary of like all about it. So this right here, it looks crazy, but these are actual pictures of the inside of my lungs. This right here is mucus. As you guys can see, like all these pictures, that's like mucus filled up in my lungs, and that's why I come in so much, and that's why I'm always sick, and that's why when I get a cold and I get more mucus in my lungs, they get blocked up a lot worse. So this one says right upper lobe with diffuse secretions. I don't know how to pronounce some of these. Bronchus intermedius with diffuse copous secretions. Left main stem bronchus filled with secretions. See if I have a new infection in my lungs, and if that's why I'm not doing so well. I have some pretty bad news. I actually don't know how long I'm going to be in here. I was thinking that I was going to get out sometime next week, but he said the soonest I'll be out of here is next Friday, and that's very unlikely because of how bad my lungs look today. It sucks, and it's really discouraging, and it is scary, really scary, because I thought that this bronch, it could have helped, but when I woke up, I couldn't even catch my breath. Like, I was coughing so bad that my ribs are so sore. I'm literally on pain meds for it. So, yeah, I'm really struggling here, but I'm just hoping that I could get out of here. And if I can get out of here and not have to come back for a while, but I'm hoping I don't have to stay a month, because I've never stayed in the hospital a month. I've stayed, the longest has been 21 days that I've stayed in the hospital, and I really don't want to stay a month. So please keep me in your prayers that we can get this out. This is the findings. This is the summary sheet, because they said they were so raw. And if you can't tell, my voice is really scratchy and stuff because they had to put a tube down my throat to help me breathe. Lidocaine 2% applied to whatever, my lungs. See the anesthesia note for document, blah, blah, blah. Procedure, pre-anesthesia, patient meds, allergies, blah, 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 blah. Severe systematic disease that is constant to threaten life. After reviewing the risks and benefits with the patient, was deemed to continue with the procedure. Findings: trachea, a lot of secretions, carina normal, I don't know what that is, I guess it's part of the lung, right mainstream filled with mucus and secretions, and it's basically just saying that, like, my lungs looked pretty bad, and they still don't look great after cleaning them out as much as he could. He said that he literally, like, could only, like, drown one side of my lung to clean out one side. I don't know if I'll have to have another bronch done or what, because if this doesn't help, I really don't know what the next step is, and it's scary, like I said, because I don't know. I mean, my lung function is in the 60s. That's not great for me, but it's not horrible, you know? Like, it's not like I'm dying, you know? It's just not good for me. And he said my oxygen levels will run a little bit lower than normal for a while. That my cough will even be worse, which sucks because every time I breathe, I can feel like crackles coming out of my lungs. So yeah, it was definitely a very intense procedure, and I'm prepared to be super sore tomorrow. The first day usually is not too bad after a bronch, but the next day, I swear, your lungs and your ribs and everything feel like they were like you were like kicked in the ribs. Like, oh, they are so sore, and laughing, coughing, anything hurts. So, and walking, just anything. So, I'm sorry that I didn't really record the bronch. I recorded as much as I could, you know, just going down there and everything. I just get really nervous before anesthesia. Like, it's weird because, like, looking up to it, I'm not very nervous, but once it gets to the time, I get super nervous. But my doctor was amazing. He talked me through it and everything, and we got it done, and I'm glad it's over with. And right now I'm on my IV steroids. They're going through right now through my port. They put me to sleep through my port. They gave me some anti-anxiety meds through my port before they put me to sleep. And they gave me some nausea medication, some Phenergan IV, and they also, I'm trying to think what all they did. And right now I'm on oxycodone every 6 hours for pain. So that's really just what is going on right now, and I will update you guys if anything else happens. Kevin is coming up tonight to stay with me. That's pretty much all I know for right now. My cousins and my aunt are coming tomorrow. But I'll talk to you guys in a little bit. I need to shower and stuff. I feel like a mess. But yeah, so I just wanted to update you guys and tell you what's going on. So I'll talk to you guys in a little bit. Hey guys, so I'm just laying here just waiting on Kevin to get here. I'm like tired, but then again I'm not tired. I don't even know how to explain it. I'm just worn out from today. It's been a long day and I don't feel good, and I'm starting to get really sore around my ribs and stuff, and it sucks. I just hope I don't have to be in here for a month, because that's kind of how it's looking. And who wants to be in here for a month? So we will see how long I'm here. I might even take a nap until Kevin gets here. I don't know. I don't really have much to do. I've literally took so much anxiety medicine today. I've been put to sleep and everything, and I'm wide awake. My pupils are like dilated. And I know it's from the steroids. And I don't know, my blood sugar might be high or something, but I know the steroids, they really get me like hyped up and stuff, and it's scary. It is. And I just hope that I can get better and get out of here, because I am ready for it. So like I said, I might not be able to be on here as much as usual. But yeah, so I'm just gonna, I guess, lay down, turn on this lamp. Just lay down and relax. That's really all I want to do right now. Hey guys, I want to sit you up. Sorry, I literally, just to sit up, it takes everything in me. I swear, you really want to just give up on everything. Because you think, like, hey, I've fought this disease my whole life, you know? And you try everything you can to get better. And nothing helps. This hospital stay, I've done everything. Everything. IV antibiotics, 3 different IV antibiotics that are super strong. IV steroids, 30 milligrams every 12 hours, which is really strong. My treatments that I do 4 to 5 times a day. And when I came in, my PFTs were 65, which is really low for me. And then they go down to 63. I don't understand. I know sometimes it takes a while longer to get better. My oxygen levels are low for me. I know there's always those people out there that are like, well, I have it way worse than you, you know. But I don't think we should put a competition around it, because we all, like, if every single CF patient goes through hell. We all know that we all go through hell. So why try and put it into a competition? I don't understand that at all. Like, oh, I'm worse off than you, blah, blah, blah. Like, it doesn't really matter. We're all fighting this disease and in and out of the hospital. I've been in and out of the hospital since I was 5 years old. And I'm thinking that I might have to be here for a month. And I know there's other CF patients that are here for way longer than a month, but this is hard. I don't think I've ever been this sick. It scares me to death. Oh, gosh. I don't know if I'm emotional from my pain medicine and everything that they have me on or whatever. But I'm just being honest. I'm scared. I want to be able to get old, and I want to have a baby. And I want my child to be able to outlive me, you know? I don't want to have to worry about dying at a young age. I've always felt like I was like made to be a mom, because I love kids and love animals, and I'm a really caring person. I mean, I have anger issues, and I think that's just because all the things I've been through in my life. I just fight it off with anger when people, like, when people try to attack me. I guess, just fight it with anger, which is not the right thing to do. You should just ignore it. Like, I'm 18 years old, I'm an adult. I need to not sit there and argue with people over Facebook or Instagram or anything, and I regret ever doing any of that. Especially people who go through the same thing as me. I don't understand. I don't understand anything. See, I don't sit here and just cry to my friends and stuff, like, about, oh, how miserable I am. I feel horrible. I'm hurting. I don't feel like I'm ever gonna get better. I'm trying everything that I can, you know? Nobody wants to sit there and hear that, so why would I just sit there and complain to everyone? But I feel like on YouTube, you know, when I vlog and stuff, that I can tell you guys anything, because it's a big group of people that actually listen and watch my videos, and when people tell me that I inspire them and stuff, it's the best feeling ever, because I never thought that I would be inspiring anyone. And when I was younger, I never thought the CF would impact me the way that it has the past year. I've been in the hospital every other month this year. And I never, ever would have thought that was possible. I remember one time about 3 years ago, I went in the hospital, and then I waited a month, and I went back in the hospital the next month, and I was like, wow, that's crazy. I've never went in this often, and now I do that every other month. Sorry, that was Kevin. He called. He's almost here. Anyways, I was set up to talk to you guys. I literally just feel miserable right now. Like, I know they said, you know, this bronch is probably going to be a little bit more aggressive, and you'll probably feel a lot worse before you get better. But the last one I had, I just didn't feel this rough, and it was about a year ago, and I'm just like, how did I get so sick in just a year? Nobody wants to think like, hey, I'm running out of time, you know? But my doctors are super encouraging, and I'm really glad. I mean, this adult CF team, they're amazing. They are. Like, they're great. So I haven't had any issues with them. They always encourage me. They're always telling me about how new medicines are going to be out, like, by this time next year and stuff. So just to keep it up, like, keep up everything. And this stay has been a huge wake-up call to get these papers. And see my lungs the way that they are. I remember when I was like 15, 16, you know, my teenage years, and on the papers they would always say that, I don't want someone to walk in on me crying. It's ugly. Sorry. They would always say on the papers that my disease was, you know, mild, and that I was okay, you know, and I never worried. Like, keeps sounding like someone's knocking on the door, sorry, but I was never worried. You know, one day I'm gonna be really sick and I'm gonna be going to the hospital all the time, and you know, I mean, I did have little tiny thoughts sometimes, like, what's the point of going to college? Because I might not make it through college. And all this, you know, I had those little thoughts, but they never really got to me. And I've been honest with the doctors and stuff, and I've told them my teenage years, I didn't do what I was supposed to do at all. I didn't do my treatments like I was supposed to. You're supposed to do them like 3 times a day, and I did maybe once a week. And now I do them more than I ever used to, and I'm here. Look at me. So what I'm honestly trying to say is, like, I'm not trying to be like, oh my gosh, do your treatments, you know, like, I'm not trying to bug you, but if you have CF and you're younger and you're like me, I swear I'm hearing the weirdest sounds next door or outside my room, I don't know. But if you're younger, don't be like me. I hid my disease until I was 17 years old. I hid my disease. I didn't tell anyone about it. And if I could go back, I would have been so much more open and just told people, not been so embarrassed about it, you know? Why be embarrassed about something that you're gonna have for the rest of your life? Why be ashamed, you know? I don't get it. I wanted to be like normal people, so I didn't do my treatments. And I always wonder, hey, if I would have done what I was supposed to, would I be where I am today? And I blame myself. I don't blame anyone else. My mom tried so hard to get me to do my treatments. And everyone tried so hard. My whole family. But I never wanted to do them. I never wanted to, like, listen. My lungs, like, just looking at these pictures, I'm like, how? They're just so full of just mucus and I don't even know if I'm gonna post this part of the video because I've never been super emotional, and I don't want you guys to think I'm doing this for attention, because that would be stupid. I don't want to look like I want attention, because that's not what I want. I want people to do their treatments, and I don't want people to ever feel like they need to hide what they have or what they are, because that's what makes you you. And I didn't realize that until I was 17 years old, that CF has made me who I am today. But anyways, I was saying, my hands are shaking really bad right now, I don't know why. But I was saying, when I was younger, 13, 14, 15, 16, you know, it always said that my CF was mild, you know, my lung damage was mild. Never really worried. And now they're not, I mean, I'm not sitting here saying like, oh my gosh, I'm the sickest CF patient ever, like I need a lung transplant. No, I'm not there at all. My lungs hurt so bad just coughing. Oh my disease has declined, and I'm not where I want to be right now. So don't think like I want attention or anything. That's not what I wanted at all. I just wanted to be open with you guys and tell you how I feel, because, you know, you can't just pretend like you're happy all the time when you're in the hospital, like pretty much half of your life. Like, how are you going to just sit there and pretend that you're happy 24/7? Because you're not. So, I'm not. And it's good to admit when you're having a hard time. And until tonight, I didn't really, like, think about it, you know. And I was like, I'm going to get on the vlog and just talk to you guys. And I didn't know what I was going to say, but then I thought, and I was just like, wow, like, look where I am today. It's crazy. And no matter what anyone tells you, you know, your life's worth it. And never feel like, even if your PFTs, I'm telling you, if they are 112 and you feel horrible and someone's trying to tell you you can't feel bad with your PFTs being that high, heck yes you can. Yeah, you can. And my PFTs are 63% right now. And I'm sure they're even lower after the bronch, because they said after the bronch that they're going to be even lower and my oxygen levels are going to run lower. And I'm going to need oxygen. I've never actually needed oxygen, except for the last bronch, but that was like for a day. I've never actually needed oxygen, you know. I've just like used it just for comfort. But right now, like, just getting up and walking to the bathroom, I get so out of breath after this bronch. So, yeah. But I'm just telling you, if any of you guys have a chronic illness or anything and you ever need someone to talk to you, I'm here 24/7. My Instagram, I'll put it right here below, and I'll put it in the link below as well. Yeah, so you guys can always DM me on Instagram, comment below. I'd love to get a hold of you guys and talk to you guys. I really care, and that's why I do the YouTube. I mean, I want to reach out to people that need help, you know, and you never feel normal. So, chronic overcomer, that's what I am. And this shirt is from the Fry Life. I got this shirt about, I think I got it like, like 5 months ago, I think. I don't know. I was supposed to mail one to one of my other CF friends. I don't know if I mailed it yet to Trinity. If I haven't, I will get your shirt out to you. I'm so sorry. But yeah, so I got me and my friends all one of these shirts. And then I have another shirt, and it's purple, and it says, "Breathing is my superpower." And that's super cute too. But I love the Fry Life. I watch them on YouTube. They're awesome. And I love this shirt just because just the little tiny saying, just saying chronic overcomer. I think it's cute. I love you guys, and thank you so much for watching this horrible, cringy part. And if you wanted to skip through that, that's fine. But I'll see you tomorrow or later on. I love you guys. Oh. Hey guys. I am so sore. My neck is so sore all over. And my chest is starting to get super sore. The second and third day of a bronch is the worst ever. I slept pretty good last night. Kevin stayed with me last night, and I slept pretty good, so that was a good thing. I probably will rest a lot today. I'm really excited because half my family's coming up. Some of my cousins, my aunt and stuff, they're coming up to see me, and I'm excited to see them. Super excited. I love them to death. They're like, Hey guys, what's up? So, I was laying here, I was about to take a nap, I'm coughing really weird because it literally hurts to cough, but, so I was gonna take a nap, and then I started talking to one of my friends. I kind of just stayed awake. I'm sure I'll nap in a little bit. I just took my pain medicine, so it might make me go to sleep. I'm waiting for my family to get up here. Kevin left kind of as soon as he woke up, and when he got here last night, we kind of just went to bed because I was worn out, and Had a long day yesterday, so just wanted to get some sleep. Gonna give me some food. I don't know what I want to eat yet. I don't know if I want some Mexican or I don't know. We'll see. Maybe Olive Garden again. I don't know. I always go between the same things, you know. Thinking about just doing a little quick little, not like makeup routine, but just stuff to like waking up my face a little bit because it's just not looking the best right now. Hey guys. Alright, so I'm just gonna do a quick tiny little makeup tutorial. I'm not putting on a lot of makeup at all. It's literally gonna be like nothing, like you can barely tell it's there, but we will see how this looks. I don't even feel like getting my huge makeup mirror out, so I'm just gonna use a palette for my mirror. And I'm using the Huda Beauty one, and I might even use a little bit of those. I might just use the Jaclyn Hill palette just because it has more of natural colors in it, so we will see. I just took my pain medicine not too long ago, so it should start kicking in any minute, and I should be able to get through this video without being in pain and stuff. I'm just really sore. It's mostly my ribs and stuff, but that's to be expected when they go inside of your chest and be really aggressive on what they're doing, but I mean they really needed to, so I'm not mad. I might straighten my hair or curl it, I'm not sure. We'll see. My face is just looks so swollen from these steroids. I don't know if it's just me that can tell what, but I'm gonna go with this rose gold elixir. I haven't really been using it much, but because I'm pretty much out of it. I'll definitely get me more. It's pretty expensive. Food or anything, you just gotta be really careful when you put this on. Alright. And when you first get it, I swear that stuff smells so good. But after having it for a while, your skin does, like, I mean, the stuff starts to smell like just kind of cooking oil, but it is really good for your skin, so. And it has like the, next up, I'm just gonna spray my face with this rose water. Tatcha Silk Canvas Primer. I'm not gonna put it on a lot at all because I don't need a lot. I'm just putting on probably a little bit of foundation, and this stuff just smooths your skin so good, and it's my favorite primer, so I always use it. I can't wait till I get to go get my nails done though. My nails are horrible right now. Now I'm using the Glam Glow Mega Illuminating Moisturizer because I love it, and it makes your glow so pretty, and it's like a, I'd call it like a tinted moisturizer because it, like, yeah, you can get nude glow or like a darker glow if you have a darker skin tone. I don't like to use too much of it though because it's literally like $60, so pretty. Alright, so now I'm gonna go with this coconut milky mist that you guys know I'm obsessed with. And the primer. I'm really trying to figure out. I'm gonna try maybe some of this Note foundation and see how I like it. See how it looks on me. It's a little bit on the thicker side of a foundation. It's pretty full coverage. I like it. I'm gonna go on with the Shape Tape, my favorite concealer. And notice I'm not putting much on at all. Now I'm going to spray my spongy onesie, and it's the one from Morphe. I'm just going to blend it out. And I'm going in with this powder brush and going on my under eyes with it to set my under eyes. Sorry about this horrible quality right now, guys. I am getting a vlogging camera and an up-close camera, like where I can do makeup videos a lot more easier and stuff. So don't worry, I will eventually. Just takes money, so I'm not really made of money right now. So, all right, now I'm gonna go with my Morphe sponge and dip into the Absolute powder, which is my favorite. It's the powder that is very expensive. It's like $63, I think. And then I just go all around my face. Sorry if my camera has been going out of focus. I didn't even notice until now. And then around the nose area, I use this powder all over my nose to set it. Just because it really gives you that really pretty glow. I feel like it makes my nose glow really, really pretty. And then I'm going to grab just a highlight brush, grab a little bit of this powder, and go on my top lip with it. I love this powder brush so much. It's the E48 and it's so good. This one seems a little bit more ashy, and just mix them. First I'm going to use the Hoola one. I go in with a few different bronzers because I love the tan look, like when you're just doing it. This is the Hoola bronzer. Now I'm going to go with the butter bronzer, which is also a favorite. It smells the best. It's literally the best smelling makeup in my opinion that I've ever smelled. I just think it smells so good and like tropical, and oh my gosh, I can't wait. Like when I go to the beach, I'm definitely going to bring this and just wear it by itself with some mascara or something. Good. So now I'm going to go in the Too Faced Chocolate Soleil bronzer. Like I said, I use a lot of different bronzers, 3 different ones on my face, which is a lot, but I love looking tan out and stuff. Like it doesn't look crazy or anything. So I'm actually doing a little bit more makeup than I thought I would, but I guess my pain medicine has kicked in pretty good, so for right now I feel okay, which is good. Not having any crazy pain. Like I said, most of the pain is in my ribs and stuff. I'm just really sore, moving around, coughing, laughing, or anything. My lungs feel like they're on fire, so that's not fun. And the brush, even touching my neck, this is a soft brush, and it's just barely touching my neck and it hurts, so. And with this powder right here, the setting powder, and this is just going to carve out the contour and the bronzer. The bronze store. So chapped, I need some Vaseline on them right now. Vaseline really works for chapped lips. I'm starting out with, and to make, like, bring everything together, I'm going to spray myself with this mist. And then some of this mist, and it's just a dewy one. Now I want to go in with some blushy blush. I have a few different blushes, but I'm going to go with this pinky one today because I really like this one. Just a peachy pink color. Well, actually it's like a rosy pink. Like, I just really like the Hourglass lighting powder. I usually go in with that at first and then after too. So I'm not putting on a lot at all right now. I'm just going under my eyes, putting on a little tiny bit. And then like after I do my eyeshadow and stuff, I'll put on more because it's like a perfecting powder and it goes under your eyes and stuff, and you just can, like, if you make any mistakes, you can fix it. So I gotta find my brow brush thing. Here it is. So this is what I've been using for eyebrows, and I actually love it a lot. Like, my mom was telling me, she's like, you're gonna love this. It's like, no, nothing's like my Maybelline brow pencil, because that is my fave. But this one is even better. Like, I just really like it. And I never thought I would find another brow pencil. I've talked to you guys about this, but hey, I'm back. So my brows are okay. They're not looking their best, but when do they ever? A lot here lately, but I am still totally down to do anyone's prom makeup that needs their prom makeup done. And I literally just charge $14 a person to get it done. So that's not a lot at all. Makeup for prom or any special occasion that's coming up, anything. Like you guys know, I love makeup, and I can do makeup pretty freaking good, especially on other people, which I never thought that I would be able to do that, because I used to try it and it would look horrible, and I did it on other people. But then I did it on one of my friends one time, and I was like, wow, I didn't know I could like do it that good on someone else. And now I really want to do people's prom makeup and make a little extra money, because we all know this girl is broke as crap. So yeah, hit me up if you need your makeup done for prom and you need a good price, because I'm all about that and I would love to do it. So do not hesitate to ask me, because I do not have any problem doing it. And if you can't even afford the if you can't afford the if you can't afford the $13, I can go down to at least like $9. But I think that's as low as I can go, just because it is makeup and it takes me a while to do and stuff. So, but yeah, so I'm really excited. I have some people that have asked me if I'll do their prom makeup. So now I just grabbed my little tiny sponge. Right now I'm carving out my brow just to make it look a little bit more even, you know. And then I also put this concealer on as a base for my eyeshadow. So the Shape Tape can do many, many good things, and I love it. But the tiny sponges are the cutest little things. I think they're Sephora brand. They are so cute. But while I'm in here, since I know I'll be in here for a while, if you guys would like to see me do like a prom makeup tutorial on like some looks that I can do on you for prom, I would love to do that as well. So comment below if you guys would like me to do that. Just leave some comments below about it, and I will so do some videos for that, because I do not mind to do that at all. So because I know, of course, people are going to wonder, you know, if I'm good or not. So I do not mind to do that for people that are wondering what kind of looks I can do. I'm trying to figure out what I want my cousins to bring me to eat, because they're going to bring me food and I don't know what I want. I could get Olive Garden, I could get Chinese. There's just a bunch of things that I could get. Alright, so now I'm going to go with the Urban Decay Primer Potion. This is the last thing I put on my eyes, and it's an eyeshadow primer. And it makes your eyeshadow go on better. And it's like really, it doesn't have really any color. It's kind of clearish, but then again, it's not clear. So I don't really know how to explain it, but I'm going to use this tiny sponge to blend it out. done. No, I'm just kidding. Okay, so I set my eyes. Now I'm going to go in with my Morphe sponge, and I'm going to go in with this powder and do a little protective layer like I always do. Blender, and I'm going to start out with the Jaclyn Hill palette, and I might just use a few different palettes. So first thing I'm going to do is I'm going to go in with this color Silk Cream. Color, I'm going to use Feels right here. It's a really pretty color. Decided. I never really know what I want to do until I'm halfway into the look, and I'm like, okay. So I'm going to go with Tickle, which is this color right here. It's very, very pretty. I'm using just my big fluffy blender, but I don't know, when you literally just go over like once with this, it's probably, I'm not kidding you, the most pigmented eyeshadow I've ever used. Lower lash line. I'll find a brush for that. Okay. And I'm going to go with Tease and Secret. I'm in moving rooms right now, so I'm packing up everything right now, so I will finish my makeup as soon as I'm done. Hey guys, I'm gonna finish up my makeup. I am still waiting on my cousins to get up here, and my aunt and stuff, so I still have time to finish my makeup. Then I'm gonna go on a walk with them, so pretty excited to see them. They're getting me Subway, so I'm also excited for the Subway. So let's finish up this makeup. Sound good? Sounds good to me. Alright. What am I doing? I did my eyeshadow. So now, did eyeliner as well. So now let's put on some mascara. I swear my favorite mascaras are always drugstore mascaras. I did really like the Monsieur Big Lash mascara though. That one's really good. Okay, lashes are on. Sorry, I got a phone call from my father. But lashes are on. My cousin's going to do my hair for me when she gets here. I don't know if I'm going to have her curl it or straighten it. I don't want her to have to like do too much, and I know straightening's easier. So I'll let her do whatever she wants. She's the sweetest. I love her so much, but I'm glad I get to see my cousins. I really am. I've missed them so freaking much. Charm. Love it. So pretty. I can't believe that CF movie is coming out in March. I think March 6th it said. I can't believe it. And I can't wait. I'm so excited to watch it. I didn't think they would ever make a big deal about like CF. Like I didn't think it would ever be like in movies and stuff, you know. I just think it's so cool that they're doing that finally. Because I never thought they would. And they have like, you know, some films that are like not even good. But they have Cole Sprouse in this one. Coconut Milky Mist, you guys know. It's my favorite. But anyways, they have Cole Sprouse in it, which is crazy. So this is my finished makeup look, guys. Okay, but I hope you guys enjoyed that little makeup tutorial for you. And I hope that this vlog, that you guys like it. I think they think I'm still in PO because they have not been. I'm on my way to meet my aunt and My cousin got my little oxygen here with me. I hate having to pull things around. It's so annoying, but I can like barely breathe, so whatever. Especially with this mask on. It is hell. Let's go to my cousin. Hey guys, so my family just left. They stayed for about, I'd say like 2 hours, and we all hung out. We took some pictures together. Oops. So I was glad to see them. I walked them out, and yes, I walked them. I walked with them and stuff. I am just laying here right now, just chilling. I think I might end the vlog right here, that way I can get it up for you guys, and that you guys really like this vlog, because this vlog was probably the most deepest and important one that I've made, I feel like, because I've just been through a lot this one, and I don't know, you know, this stay has been pretty hard on me, and I got moved rooms. I think I already told you, but yeah, so hoping I can get out sometime next weekish, you know, like maybe Wednesday or something. I just don't want to stay here for 3 weeks or a month like they have been saying. I don't know. I just really hope I don't have to. Hopefully I can get these PFTs back up and that things work out and I can go home and see my doggy that I miss like crazy. I eat something. I might go down to the cafeteria in a little bit, but I also might just eat something in here. I don't know. I might take a nap, but then again, it's like about 7, so what's the point of taking a nap? I don't know. But anyways, ready to go home. That is one thing that I'm really ready for, is to go home. And hopefully I can really soon. Hope you guys enjoyed this vlog, and if you did, give it a thumbs up. And subscribe to my channel if you haven't already. You should really subscribe, because we have all kinds of fun on this channel, and if you don't subscribe, then what's wrong with you? I don't understand. Just subscribe and watch my videos, because my videos are pretty cool, honestly. Just saying. But anyways, so thank you guys for watching. I love you guys, and I hope this vlog really opened you up to kind of who I am, and just like told you more about myself than you guys thought, you know, because it really opened up to you guys. But hope you guys enjoyed this vlog, and give it a big thumbs up if you liked it. If you liked it. If you didn't like it, still give it a thumbs up, because I deserve it. Because I'm really sore. And I feel horrible, so come on. Alright, bye guys, love you.